Okay.
All right, so yeah, Pastor Jeremy asked me just to give you an update, kind of where we're at with this COVID pandemic here. I mean, you hear all the things in the nation, and Colorado is a little different, but I think the idea in a quick summary is it's still there. It hasn't changed. It's around. Colorado has done a very good job of doing what we needed to do to social distance. The stay at home now, kind of stay safe now is where we're at. And as you can see, there's some states are increasing their numbers, increasing hospitalizations because they haven't done the right thing. There's plants that they don't have the testing that they needed to get done. So we're still in this environment, so that hasn't changed. The good thing is that Colorado is actually doing a very good job at this time. The last time I saw hospitalizations, I think they averaged out to, if you look at the hospitals per the state, it was like on average like 2 per hospital, people who have COVID that were hospitalized. Not that that's spread out evenly, but you know, we're down to, it was under, I think, 160 people in the hospital throughout the state late last week. So that's excellent. So with that, I know that the restaurants are opening up with restrictions. There's been some other thought processes with parks and how do you keep things clean and people still social distancing, but allowing kind of the economy to wake up, and also the communities. I think we're still in this situation though where large groups are not a good thing. I think we're kind of there's this different sort of numbers game. How many people can you have in one place, and social distance? And I think they're looking at, you know, for social groups like 10 or less, and for large groups, I think 50 or less, but it's still with masks, distances of 6 feet, creating avenues of entering, exiting areas safely, so you're not interacting. Hand sanitation is still a big factor, but we found that masks do play a big role in prevention and spread of COVID. You wear a mask to prevent people from getting it from you. So if you have to be one of the asymptomatic people, the mask is a way for you not to spread to somebody else. So the mask does provide a little bit of protection for you, but mostly it's protecting everyone from you because of the droplet spread. So nothing has changed in the sense that it's still a dangerous virus out there, but we're doing better. On the horizon, I know there's a lot of work being done between the vaccines and treatment that are very promising. They're still in the kind of the trial stages. If we look at vaccines, probably, widespread vaccines, we're talking about a year or so. When I talk about widespread, meaning the population in general, like sort of like the flu shots. But I think I have a prediction that the vaccines will be out for some limited populations, probably towards the end of this year, early next year, because of the positive sort of response they've gotten. They're going in the trial phases. UC Health is actually going to be part of that. Getting 1,000 volunteers from a variety of age groups and things to see what immune responses are to this, starting in July. So that's there. There's also treatments that are ongoing, and when do you start treating people with these antivirals? What's the combinations of those? And so there's some things that are going on that are positive. You just don't hear about it all with all the rising cases and things. The reason they don't really want, I think, to really publicize a lot of this is people become very flippant then and think like everything's great, but even with these new treatments, you don't have enough meds to go around. It's more in the research phase. But once they figure this out, a lot of the pharmaceutical companies are sitting ready to ramp up a lot of production. So that's what I understand the state where we're at right now. I'm not the infectious disease person or sat on any committees with UC Health, just kind of the things I've read and things that have been poured out to us from UC Health. But as you've seen, I think in our hospitals, at least for UC Health, all the tents are down. We don't have the triage tents anymore. And we've opened up the clinics a little bit more, knowing what's kind of how this is transmitted. And how we can best prevent people from, transmitting to each other as they interact in their healthcare side. So if anybody has any questions. Awesome.
Thanks, Bill. I do want to, I was going to show a couple of the slides real quick from the faith leader update that came out from the State Department of Health. So on Friday, there was a WebEx, Zoom call thing for faith leaders that came from the Department of Health in the state of Colorado, kind of giving us kind of some specific, look and some guidance and some hope and expectation for us. And I won't go through the whole thing. It is available. I emailed everybody on Ad Council a link to the shared folder we're using. The COVID safety team that we have at the church is using to share all our documents. So one of the things in there is this slideshow. I want to just point out a couple of things based on what they said that kind of struck home with me so high level social distancing is still needed along with mask wearing in order to avoid exceeding hospital capacity. As Bill said, the trends are lower, but at the beginning, what they said is hospitalizations are slowing down, but the rate of the decline is also slowing down. So it's good. It's kind of good news, but not as good as we'd like. So they're still recommending a high level social distancing. And they kept harping on this a lot, and I understand why. Older adults maintaining high level social distancing is critical. So one of the things that we can expect as this thing continues to unfold is they let us know is that we might start seeing some guidance for different, that is specific to different age groups, with the most restrictive guidance being for those over the age of 60. That's the most important group, because 9 out of 10 deaths in the state of Colorado from COVID have been people over 60. Not everybody, but again, 9 out of 10. So, they were very insistent that we as church leaders and faith leaders who have churches that serve a lot of people over 60, that we be cognizant of that. The models that they projected now, most of them do show around mid-August, the date at which school starts up, the epidemic curves start to show a rise again. And there is an expectation, they said, of the next peak, another peak in COVID that's actually going to be larger than the April one. So these are all things that are kind of weighing on my mind, and that our team and everybody's taking into account as we do decide to figure out what we can do when we feel we can do it. One of the things that they shared at this was there was actually some studies done pre-COVID about where different age groups meet. And there's one reliable place where people over the age of 60 interact with people under the age of 18, and that's a church. There really isn't anywhere else in society that people over the age of 60 and people under the age of 18 congregate. And so there's some real concern, in my mind, some valid concern for what happens when schools do begin to even reopen a little bit, and whatever capacity they do. Anybody who's a parent of young children know they bring everything home with them, and obviously we'll do our best. The school will do their best to protect that, but it's not going to be perfect. So that's another thing that hadn't quite been on my radar before then. It's not only, how many people gather, but which people are gathering. And kids are definitely going to be in a place where they're going to have, especially when school's back into session, more opportunities to be exposed. It's not going to be as big, and part of expectations is not as big a deal for them because they're generally healthier and the immune systems are healthier. It's who they then interact with. And what they don't want to see us, and I don't want to see us do, is be a place where that kind of cross, pollination, you may say, between these different groups of people happen. And it's interesting, the church is one of those places, and actually one of the only places where that happens. So we are, the kind of being led out of the trustees, but we've kind of developed a small group with several, kind of across different areas of our church that are developing plans. Again, you can see a draft of that in our current thinking in that folder. While we're coming up with scenarios, there aren't any dates yet for any of it, because really the virus is going to tell us when we can do these things. But we did want to have some plans in place for both gatherings of 10 or less and then gatherings of 50 or less is what we're working on now. Is how might we, knowing where we are and where we're going, how might we do those safely? So I would expect to see some of the scenarios that are, groups of 10 or less first. That's, and I think Bill, you mentioned that in your thing, that's, if nothing else, it contains it, the possible risk pool to a smaller group. And then maybe down the line, we could start thinking about groups of 50 or less. It's the horizon towards probably gatherings of more than 50, pretty much across the board from everybody, is that's still a good ways off. So we will figure out, how we continue to, adapt to that and all that. Most of the scenarios we're working on now are sort of, change by addition kind of ideas, where we will provide opportunities that are in addition to our current opportunities. So maybe a Sunday afternoon gathering that has, a limited number of people per what we feel we can do safely. That is in addition to what we were already doing and will continue to do on Sunday mornings with our live stream at 9:30. So rather than trying to, the other challenge is we want to keep doing well what we're doing well, and not kind of overly complicate or erode the quality of what we're doing well already by trying to do too many things at once. I personally would rather just, again, kind of change by addition, where we maybe give some extra, some new opportunities for people to gather in person that are just in addition to what we're already doing on Sunday morning. That, again, structured from the beginning and get-go in a way that we can do safely. So the other document you'll find on there is actually a task list that we've put together that we'll need to be working on. I would really recommend you look at that, because we could use, there's opportunities to help on some of the stuff if you want to. But we did generate a task list of things that we know need to be accomplished before we can, several of those need to be done before we can invite anybody in the building. Some of them are more related to the larger groups of people who we're doing. So, but we do have some limited, very small group, like 6 or less, visitation happening through our Shepherds program right now, especially targeting those who are in the most isolated of scenarios. We have people who have been sheltering at home by themselves for months, and we need to love on those folks, but we need to do it in a way that's loving and not, so we do have that starting in a kind of a trial run capacity right now. And we developed some pretty important and safety guidelines for people who participate in that. But to at least get 4 or 5 people gathering in folks' backyards, just for a little human interaction and some time to fellowship and pray together and stuff like that, I think is the lifeline we have a lot of people who need in this moment. So we're trying to be good balances of everything. I mean, I would love to just wrap you all in bubble wrap, right? Seal you in your homes and wrap you in bubble wrap, maybe put you all in like comas for a while and then tell us it's all over and then we can just all wake up together. I wish that was an option, but it's not. The goal is to make sure that the goal is to make sure we get everybody to the other side of this. So much as it is in our control, we want everybody on the other side of this, so. I don't know if Richard, you want to add anything from trustee perspective on this?
Yeah, no, I think Jeremy summarized it very well. We do have some tasks to accomplish before we can let anybody in. I think what I want to do, and we're doing some of that stuff. Hand sanitizing stations, we've put some on order. See if we get them. There's a run on them. Apparently everyone who's opening wants one. And, so we're getting that in place. There'll be some other structural things we're going to look at for segregation, isolation, egress, and exits. One of the points I did want to make was this is structured for when the public comes into the building or on the property for a gathering, an organized gathering by the church. That's the thought process, right?
Yeah, we do have folks. That's a good point, Richard. Yeah, everything's aimed at that. Like when we'll start inviting, we do have obviously the bandies are there working on stuff, and we do have limited groups of people, you know, staff and specific staff and volunteers that are coming in now and to do various tasks around the building. And so we've tried to develop protocols for that, but this is all aimed at when we're opening up towards, you know, just general participation by the public. So we have developed a scenario for our confirmands. We really need to celebrate them and their hard work. So we're going to do a couple things for them, but that includes probably a kind of drive-by after church on a Sunday in July, where we'll have them safely distanced and lined up out on the curb, and you'll be able to invite them to come and drive by and, you know, say hi and congratulate them on everything that they've accomplished as well. So a lot of really good and creative thought. We had a tomorrow's team meeting about this. I went in with kind of one idea that we immediately got rid of because it wasn't very good, and then came up with 6 really good ones. And then the COVID safety team got together and paired what we wanted to do versus what we could actually do. And I think arrived at a pretty good list for the near term of scenarios that seem plausible for us to participate in and get people at least something of what they want. And what folks really want is they want to see people, and they want to gather, and they want to, you know, share that special sacred place with one another. And I completely get that. So yeah. Anybody have any questions?
Okay.
All right.
Very good. Thank you, Bill. Thanks, Pastor. Thanks, Richard. Appreciate that.